Welcome to Bright Eyes and Face Medspa. My name is Morgan Van Solkema. I'm one of the physician associates here, and today we're going to be talking about hormone replacement therapy and the blood work we offer here, and why you might want to get your blood drawn. Just as a reminder, we have 2 locations, one in Hazleton and one in Tannersville, and we are a full-service professional medical spa. So we have all things from Botox and filler and microneedling to blood work, hormone replacement therapy. We have an awesome esthetician who does facials, lashes, brows. We offer GLPs, a whole array of peptides for wellness and longevity, and a ton of other amazing med spa services like IV hydration. So come on in and see us. Consults are always free. So today, to get into what we're going to talk about is mainly hormone replacement therapy, but also a couple other reasons why you might want to get your blood work drawn. So I have a lot of people come into me and say, I just feel a little off. I feel tired. I don't have any energy. And that's a tricky place to start because that's a lot of us. A lot of people are tired, whether it's from work or kids or just aging in general. The problem is a lot of things could cause that. So there really is no one nice fix-all type of answer to that. The best place to start is typically blood work. Blood work can show us all the basic things like your blood count and how your liver and kidney are functioning, down to vitamins. So things like vitamin D and B12. They're very important vitamins in our body that cause a cascade of other problems if they're low or high for that matter. So one thing we always check in patients who have these symptoms like fatigue, energy, mood issues, just overall just kind of feeling run down and not like their most optimized self is vitamins. Vitamin D and B12 are most commonly the vitamins that are low in us, and they both have very important roles in our body. So B12 has a really important role in our GI tract. If our B12 is low, we don't absorb nutrients properly. So no matter how healthy we eat, those nutrients, the micronutrients, cannot be absorbed into our bloodstream properly. So having an optimized B12 is really important for our overall health. Low B12 is often seen in people who don't eat a lot of meat protein, and also a lot of people who are losing weight. So right now GLPs are really common, which is great to help us lose weight. But one of those things that can be caused by it from that GI tract dysregulation is a low B12. So whether you're on a GLP or you just have overall fatigue and energy issues, getting that checked is something really simple to do and also something really simple to fix. Same thing with vitamin D. So vitamin D has a really important role in our bones and how our calcium is regulated in our body. So when we have low vitamin D, it's really similar symptoms to B12, that fatigue, energy, mood changes. So getting that checked can be really easy and a simple fix. What you don't want to do is go down a rabbit hole of, trying all these expensive supplements and fancy products that you can buy online before you get these vitamins checked. Vitamins are super easy to fix. We offer injections in the office. They're very, very cheap. So if you are deficient in one of those vitamins, we have you come in for a simple injection, and that will boost it back up. Another thing that could kind of fall into this category of general fatigue and energy issues are abnormalities in your hormones. So that's one thing I really kind of wanted to talk about today is hormone replacement therapy. A lot of people are talking about it recently because for a long time, hormone replacement therapy got a bad rap. It was kind of frowned upon to do hormone replacement therapy, and it was only used in really specific situations. But now we know that for the majority of people, it's really safe to replace hormones as long as it's done by a professional medical provider. So men and women need testosterone and estrogen to function properly. And so that's one of the common misconceptions, is that in traditional medicine, we often don't check women's testosterone. Low testosterone, or even just what I like to say like suboptimal testosterone, can present as really just low energy, that really fatigue where you wake up and you just don't feel like going about your normal day. Low testosterone can also affect your mood, it can affect libido, and it can affect hair growth. So a lot of these things kind of coincide with each other, and getting blood work drawn that tests all of it at once is the best way to see what is off and what is not. So when we check your blood work for our hormone replacement therapy, we're looking at a few things. We're looking at, of course, testosterone. We're looking at estrogen, progesterone, and then we're looking at a few other markers that affect how our hormones are played in our bloodstream. One of them is DHEA, and the other one is SHBG. Both of those things are very important to understand why a hormone is elevated or not. So if one of these things come back abnormal, what do? We are able to treat everything here for you. So a lot of times somebody will order blood work for you and then they're not comfortable with treating that abnormality in the lab. But here we specialize in hormone replacement therapy. We prescribe everything through our compounding pharmacy, and it directly ships to your house. So say you're a male and you want to optimize your testosterone, whether it be that it's low or you're just looking for increased muscle development, for whether you're lifting weights or just trying to have that optimal testosterone, we'll call in to our pharmacy that testosterone and it'll ship to your house. If you're a female, the best form of testosterone, in my opinion, is if you do a cream. So it's super simple, not even an injection, and you just put that cream on your skin once a day. If it's estrogen that's low, then we can supplement it in multiple ways. This time of year, I feel like a lot of people love a patch. It's simple, you put it on, and then you replace it every once in a while. There's also pills and creams. So there's a whole ton of variety of what we can offer you to keep those hormones optimal. And just a slight bump up in that testosterone and estrogen, if you're low in it, could really help symptoms of fatigue, energy, libido, mood. And then from there, we'll monitor your hormones. So if you do hormone replacement therapy, we'll want to get your hormones checked every couple of months to make sure that they're optimal, to make sure that you feel okay, and that those levels stay in range. Another really common reason that you'll want to come in and get your blood work checked with us is if you're on a GLP. GLPs are super common and really help us lose weight, but it can cause other things, like I mentioned before, like B12 to be low. So getting your vitamins and hormones, we'll just check it all at once, checked is really important when you're on a GLP. Definitely not mandatory, but can really help give you that energy if you're low in one of these vitamins. So a lot of people, as they're losing weight, especially in the initial phase, they do feel a little fatigued, and some tiredness is normal, and it doesn't mean that anything's wrong. But if you feel that persistent fatigue where you just don't feel like you want to get up and go to work and do your normal life stuff, then come in and get your blood work checked. It's really affordable. It gives you a really nice picture of your overall health. And if everything's normal, great. If a vitamin is off, we can supplement that. And then we'll go from there. You can get it rechecked in 6 months, a year, whatever you're comfortable with. But then as you're losing weight on your GLP, it helps to make sure everything else is optimized and that your overall health is being looked at instead of just taking a GLP and losing weight. And aside from that, we offer a whole other range of blood work that you can get, whether you have a current issue going on, like an autoimmune issue, or you want to check things like allergy and environmental sensitivities. So we have a really awesome panel that looks at environmental allergies. So the basic things that you can think of, like grass and dust and pet stuff, but they go really in detail with specific allergens of specific types of plants and seeds, and environmental things like dust and pollens and animals, and it's really awesome how detailed these labs are. And then there's also a panel that looks at food sensitivity. So not only like your basic dairy and fruits and veggies and different seeds, but a whole variety. I mean, I can't even list how many hundreds of different specific markers that these allergy panels look at. So if you have a current allergy or sensitivity to something, or you've always kind of suspected it and never really known, you can come in, we'll draw your blood, and within a day or two, you'll have answers as to what exactly you have this sensitivity or reaction to. And yeah, so if there's anything that you're concerned about, just come in for a free consultation and we'll kind of talk about what your symptoms are, what you want to get checked. We can either draw your blood that day or we can schedule you to come back in for another appointment. But when we come back from this break, we are going to actually draw my blood. So I've never had my blood work tested here before because I usually don't get the privilege of having one of our other providers with us. So Caitlin is here today. She's going to draw my blood. She'll kind of describe the process of what we do and how quickly you get your results. And then we'll do that. And in a couple days, I'll have answers to a lot of my vitamins and hormones and anything that comes back abnormal. So tune in when we come on back to our show with Bright Eyes and Face Med Spa. My name is Morgan, and I'll see you soon. Welcome back to Bright Eyes and Face Med Spa. Thank you for tuning in today. And now we're gonna do the best part, which is where we draw my blood. So just as a reminder, we have two locations, Hazleton and Tannersville. We have our full med spa in both of those locations where you can get all of the awesome treatments we offer, from injectables to IV hydration, facials, lab work, hormone replacement therapy, peptides, GLPs, you name it. So as this last part, Caitlin, who's one of our awesome providers in our Hazleton location, is going to draw my blood, and she's just gonna explain a little bit about what she's doing.
So after we talk with the patient, figure out kind of what their goals are with their wellness, whether it be weight loss, usually we'll kind of discuss what blood work panel would fit them best. And then so you can get your hormones checked, your thyroid, vitamins, other metabolic markers. And it just kind of helps give us an overall good picture of your overall wellness, as our body does work, multiple parts all together. And so often when one thing is off, like our hormones or vitamins or thyroid, it can kind of cascade and ripple effect into, other symptoms like low mood, low energy, poor sleep, trouble with weight management. And so drawing the blood's the easy part. So we're going to do that on Morgan today. Fist, nice.
Caitlin also gave me an IV last week. Usually we all are like in the clinic by ourselves and we don't get the luxury of having somebody with us. So when she was here with me last week, I said, hey, can you give me an IV? And we did a whole bunch of awesome vitamins. And I was just feeling a little under the weather and it helped me a lot.
Awesome.
I'll hold it for you.
Thank you.
Gotcha.
Beautiful.
Easy. The drawing the blood is the easy part. Perfect. Awesome. So after we draw your blood, the process is super simple. We send it off to our, it's a nationwide blood work company that we use, and they send us your personalized results back within 48 hours, sometimes a little quicker, but 48 hours. As soon as we get the blood work, one of our providers will call you and we'll go through all of your labs. If anything is off, for example, if your vitamin D is low or if B12 is low, we have all those vitamins here that we can supplement in the office. It's as simple as an injection that you can get once a month if needed. And then down the line, we could always check your blood work again. But as Caitlin said, any abnormality like low vitamin D, low B12, any abnormality in your hormones, that can cause a lot of similar symptoms. Most people have some level of fatigue and just overall energy is low. And so by drawing your blood work, it's really the only definitive way to know exactly what is going on. And if the best thing is if everything comes back normal, because then we know, okay, all of your labs are normal. Where do we go from here? Maybe it's something as simple as a little IV hydration to get you hydrated again. And yeah, so that was the simple part. And in probably 1 to 2 days, all of my blood work will be back. And Caitlin can kind of go through and review it all with me. I'm really curious to see if my vitamin D and vitamin B12 is low. It always has been low, and so I've been doing vitamin D injections and B12 injections in the office here, usually like once a month, just to kind of keep that up. So I'm curious to see what that is, and that's all. It's a super easy process. All of our blood work is very affordable. It typically ranges from like $100 to $200. It all just depends on what panel that you want to get run, and that's all. So if you have any questions, our consultations are always free. Come on in, chat with us, go over all of your symptoms and what's going on, and we can talk about the best route for you, whether it starts with blood work or not. And that's all. We'll go over everything with you. Thank you for tuning in. Again, my name is Morgan Van Solkema. I'm one of the providers here at Bright Eyes. We have locations in Hazleton and Tannersville. You can see us at either location for all of our services, including Botox, filler, microneedling, IV hydration, blood work, hormones, you name it. We have a wonderful esthetician in our locations that do facials, lashes, brows. So thank you for tuning in. Stay tuned for our next show, and we'll see you then.